So the study, the BROADWAY study, was a study designed to look at LDL lowering and HDL increase in patients with cardiovascular disease. This was a study conducted in many countries, among which the United States and Europe, in which Obicetrapib, which is a CETP inhibitor, was tested in a cardiovascular risk population of 65 years of mean age, with all people on statins, but who didn't achieve a low enough LDL cholesterol lowering on the regular therapy. So they were all on statins or even on other therapies. There were diabetes, they had hypertension, so a really sort of sick population in that sense. And we showed, and that was published in the New England Journal, that the CETP inhibitor actually could reduce LDL cholesterol with over 50% in those populations, and increased, almost doubled the amount of HDL cholesterol, so the good cholesterol. Now, we were intrigued actually to test also whether this drug could have an effect on Alzheimer's biomarkers, because we know that CETP inhibition actually has an influence on the brain, and cholesterol in neurons is a very detrimental sort of part of the whole Alzheimer's cascade, especially in APOE4 carriers. So we had the BROADWAY trial, 1-year trial, 2,500 individuals. We were able to do a baseline and 1-year follow-up biomarker data, APOE4, APOE in general, and also the Alzheimer biomarkers in those individuals. And we achieved ultimately 1,535 people with complete data. And I'm going to show on Wednesday that we had a very significant influence of Obicetrapib on the p-tau217 evolution over time. So in the placebo group you see it increase, and in the Obicetrapib group actually it decreased. So very significant result that actually shows us that Obicetrapib is able to influence AD biomarkers, and that may offer a potential for prevention in the future. Of note, the study was a very cardiovascular typical study with more men than women, which is different in Alzheimer's studies usually, and of course very high risk profile for cardiovascular disease. And at the presentation on Wednesday, I will show also that we did more than only p-tau217, and you really have to come to the presentation to know more, because we also saw an effect on some of the others that we tested. So that makes the picture even more complete.